Hello, this is our news, and we will be taking you across the country, all over the world, to talk about the COVID-19 virus. First, I'm going to lead you off with Matt. He will be taking you from the United States, and then we'll be going off to Mason in Asia. Next, we'll follow with Emma, who is in South America, and ending with Tyler, who will be in Europe. All right, let's take it to Matt.
Thank you and good evening, everyone. Today, I'll be taking a closer look at COVID-19 in the United States and how we are still monitoring and tracking the virus till this day. For those who don't know, COVID-19 is a respiratory illness which was caused by the coronavirus. And while the first spread worldwide was back in 2020, we are still seeing cases till this day as it's yet to fully disappear. According to the World Health Organization, countries are still tracking cases and are paying close attention for any changes and also see how the virus behaves. Here in the United States, health officials continue to follow COVID-19 trends closely as well. This is done with one main tool, and it is called the reproduction number, or RT for short. According to the CDC, this number helps show whether the virus is spreading or is slowing down in real time. When RT is above the number 1, it means that each infected person is passing the virus to more than one other person. That's when the cases start to increase. The number drops below 1. It will show that the spread is slowing down and the cases are slowing down as well. This kind of data gives a clear picture of what's happening now in the present moment and not what's happening in the past. And recent pattern shows while COVID-19 is more controlled than what it used to be, it is still coming in waves, especially during certain times of the year, like winter, for example. Even though the situation has improved, COVID-19 still have serious effects, especially for certain groups. Research supported by the National Institute of Health shows that older adults, especially adults over the age of 65, and people with health conditions remain the most at risk for this severe illness. For example, if you have any condition like heart disease, diabetes, or a weak immune system, it can make it harder for the body to fight off the virus, which then could lead to more serious complications. There are also differences in how COVID affect different communities. In many cases, there are certain factors like access to healthcare, job exposures, and living conditions, as it plays a key role in how the virus spreads and who will be mostly impacted. Compared to earlier in the pandemic, most cases today are less severe, and a big reason for that is the immunity, whether it's coming from the vaccine or from people previously exposed, or even both. This has helped reduce hospitalization and death all across the country. At this time, health officials are still paying close attention to new vaccines and changes to the symptoms, although even one small change of the virus can affect how quickly it can spread and how serious it could become. So while COVID-19 is no longer considered a global emergency, it hasn't gone away at all. Instead, it has become an ongoing public health issue that continues to be monitored and managed for now. COVID-19 remains present, but under much more control than the past. For a closer look for how COVID-19 is affecting other parts of the world, I'm going to pass it over to Mason.
Thank you, Matt. Good evening. I'm reporting for Global News Network with an update on the impact of COVID-19 across Asia, and I'm Mason Lemieux. The virus was identified first in Wuhan, China in the late 2019 and quickly spread across the continent. Since then, Asia has recorded over 221 million confirmed cases of COVID-19. Out of those, more than 1.5 million people have died, showing the serious impact of the virus on public health. Despite the high number of infections, over 205 million people have recovered thanks to medical care, vaccines, and public health care. The overall mortality rate, also known as the case fatality rate, has generally ranged around 1% or lower in many parts of Asia, though it varies from healthcare access across country income levels. Countries like South Korea, Japan, and India implemented strict safety measures such as lockdown, mask mandates, and mass vaccination campaigns to slow the spread. Hospitals also across the region faced intense pressure during peak waves, with healthcare workers working around the clock to treat patients. Even today, challenges remain. Some countries continue to deal with new variants, while others struggle with equal vaccine distribution, especially in rural areas. While the numbers remain significant, Asia has made major progress in controlling the virus. Health officials continue to stress vaccination, hygiene, and wearing masks. These are all key tools as in moving forward to get through this. Reporting for the Global News Network, I'm signing off. Stay safe. Thank you for your watching. I'm going to take you to Emma.
Good evening, this is Emma Pero reporting live from South America, and tonight we are going to focus on the COVID-19 and examining the scales throughout the key outbreaks and the key statistics and what those numbers reveal about our region's experience. Since the virus reached South America in February 2020, the region has recovered over 67 million confirmed COVID-19 cases and more than 1.3 million deaths. According to the data that was compiled by the World Health Organization and global trackers such as Our World in Data, this translates to an approximate case fatality rate around 2%, meaning that every 2 out of 100 people died and resulting in COVID. These figures vary by country, and with Peru reporting some of the highest mortality rates per capita, while others saw lower rates due to differences in healthcare across testing and reporting access. At the height of the pandemic, South America has become one of the most global epicenters. Countries including Brazil, Argentina, and Colombia and Peru accounted for the majority of the cases and deaths in the region. Brazil alone had hundreds and thousands of fatalities, making it one of the hardest hit countries worldwide. Historical data from organizations and the International Organization of Migration show that mid-2021, South America has already surpassed 32 million cases and 1 million deaths, underscoring how quickly the crisis escalated in its early phases. Mortality across the region has shaped by multiple factors including healthcare system capacity, urban density, economic inequality, and the timing of public health measures. In many areas, hospitals have faced critical shortages of oxygen, ICU beds, and medical staff. Later on, vaccinations marked a turning point, with increased coverage supported by international partnerships and national rule-out efforts. Rates of severe illnesses and death declined significantly. Today, while COVID-19 is no longer the global emergency it once was, the numbers remain a stark reminder of its impact. South America continues to address long-term health effects, economic recovery, and improvements in the health preparedness. And in South America, the COVID-19 is usually, through these numbers, millions infected, over 1 million lives lost, and the ongoing effect to rebuild its aftermath. For now, this has been your Global Report from Emma Pero. Stay informed, stay safe, and good night. And here's Tyler.
Good evening. My name is Tyler Rocker, reporting live from San Miguel in the Azores, and this is your nightly news report. Tonight we take an in-depth look at how COVID-19 impacted the Azores, a remote group of 9 volcanic islands in the Atlantic Ocean in a region of Portugal. First, some background. COVID-19 was first identified in late 2019 and quickly spread across the globe in early 2020. By March of that year, the World Health Organization had declared it a pandemic. Countries worldwide faced unprecedented challenges, implementing lockdowns, travel restrictions, and public health measures in an effort to slow the spread of the virus and prevent healthcare systems from becoming overwhelmed. For the Azores, isolation was both a strength and a vulnerability. Located roughly 1,000 miles off the coast of mainland Portugal, the islands are home to a relatively small population spread across 9 islands, while their remoteness provided some natural protection from the rapid scene spread in larger urban centers. It also meant limited access to advanced medical care and fewer hospital resources. Recognizing these risks early on, regional authorities moved quickly. Strict travel controls were introduced, including mandatory testing for incoming passengers, quarantine requirements, and significant reductions in flights. At time, travel to the island was nearly shut down entirely. These measures were among the most important factors in keeping infection rates relatively low during the early stages of the pandemic. However, this success came with a major economic cost. Tourism is a cornerstone of the Azorean island. Known for their lush green landscapes, volcanic craters, hot springs, and marine life, the islands have been growing in popularity as a travel destination in the years leading up to the pandemic. But as global travel came to a halt, the effects were immediate and severe. Hotels stood empty, tours were canceled, and local businesses that relied on visitors, such as restaurant, transportation services, and small shops, experienced dramatic losses in revenue. Seasonal workers, in particular, were hit hard, as peak tourism months no longer provided the income they once did. For many residents, this translated into reduced working hours, temporary layoffs, or job losses. Daily life across the island also changed significantly. Schools adapted to remote learning when necessary, and students and teachers had to adjust to new technologies and routines. Public gatherings were limited, festivals were canceled, and mask wearing became a normal part of daily life. In tight-knit communities, where social interaction plays a central role, these changes were deeply felt. Despite the challenges, people of the Azorean community showed strong resilience. Local governments introduced financial support programs aimed at helping businesses and workers stay afloat. Communities rallied around local businesses, encouraging residents to buy local to help sustain the economy during difficult times. As the pandemic progressed into 2021, vaccines became available, making a turning point. The Azores implemented a structured vaccine campaign, prioritizing vulnerable populations and healthcare workers. Due to effective coordination and the small population size, vaccination efforts moved efficiently, allowing restrictions to gradually ease over time. With increased vaccination rates, tourism slowly began to return. Visitors once again arrived to experience the island's natural beauty, providing a much-needed boost to the local economy. However, recovery has been gradual, and some businesses continue to feel the long-term effects of the pandemic. Today, the Azores stand as an example of how proactive measures, geographic isolation, and strong community cooperation can help mitigate the impact of a global crisis. While the pandemic has brought significant challenges, it also highlighted the resilience and adaptability of the islands and their people. That's all for tonight's report. Reporting from San Miguel, I'm your news reporter, Tyler Rocchio. Good night.